The medial malleolus, which is the base of the tibia. If you plantar flex the foot downward, you can feel the dome of the talus because it rolls out from underneath. With the foot back into dorsiflexion is where the foot is more stable. When it is plantar flexed, it's unstable. You have a lot of motion. That is why a majority of your injuries are plantar flexion inversion, because it has to be at. If it's back like this in dorsiflexion and inverts, that's where you have a greater chance of tearing the posterior talofibular ligament, because that is where it would be tight. Remember, your anterior talofibular is the most common, calcaneofibular. Then on the posterior, your foot has to be pretty well dorsiflexed backward. So this could be happening if, say, jumping, you happen to step on somebody's foot, it forces your foot backwards, but then you roll it under. So it can happen, you know, occasionally. So for palpation, you want to make sure you can feel the metatarsal heads, okay? Through here, we didn't get a chance to do this last week. Feel all the metatarsal heads, okay? Feel down things. I want you to feel for the styloid process on that fifth, little bump right there. And you can feel how it drops inward as soft tissue, okay? Under there is where you have all your midfoot. So you forefoot, your midfoot, and your hindfoot, the calcaneus, okay? With the knee, we said when they're sitting and they're relaxed, the patella is very movable, okay? It moves up, down, around, all over the place, okay? So it's got a lot of friction. The quadriceps comes down right here on the tibia. You can feel it come down is the tibial tubercle, okay? You'll feel a little bump right there. That is where the patella attaches. That is where you get Osgood-Schlatters or jumper's knee, okay? Jumper's knee is also tendonitis. It's basically patellar tendonitis. It's because of a lot of reasons. One, you could have a very tight quad, so it's constantly putting tension on the patella and on its insertion point. That is where the patella straps, you asked me about. When you have tendonitis and it's pulling down here, you're getting a lot of pain down here. By putting a strap around the patellar tendon, now the pressure is at the strap and not at the insertion. That is why the strap, it works, but it's basically a stopgap. You're really not dealing with the issue. You're just taking care of the pain for a while. So, you know, I always laugh because you see all these people out recreational with all their tennis straps and elbow straps, because the same issue for the elbow, tennis elbow up here is a strap on the forearm, so the pressure's at the strap and not up at the insertion. So it takes their pain away, but you really need to deal with the issue. Okay, and part of the issue is one, she needs to strengthen the quads as well as stretch the quadriceps muscles. Okay, some of it Osgood-Schlatters, you'll get a real thickening calcification at this insertion point because it's pulling, it's putting stress on the bone. So the bone's reading, okay, I'm fracturing or I'm getting problems here, so I need to lay down new bone. So you'll get calcification and a real thick buildup. Some of that is, I say, growing pains. You know, we see it a little bit more in boys or guys, and guys will grow all the way up until their 20s. Okay, so even at this age in college, I'll still see some Osgood-Schlatters or jumpers problem. Okay, so it doesn't mean that goes away. So you want to feel that area. One thing you want to be able to feel, have them bend their knee, hang off the edge. You'll feel when they bend their leg, you can feel along the edge of the patella the dome of the femur. Okay, or the articular cartilage, epicondyles of the femur, okay? Right below it, you'll feel a little edge, and you have, when you're palpating, you got to kind of dig in. You can't palpate by the palm of the hand. And this is something, now that you get away, but it's a thing I have with some of the massage people is they get too palmy and fingery, you know, trying to do the massage aspect. And that's fine when you're trying to work the soft tissue, but when you're trying to pinpoint areas, you have to get very point specific. So you got to get the points of your fingers or your thumb into certain areas, and you got to kind of push, dig. But you should find the joint line, and you can kind of find it by if you flex and extend their leg, you'll feel the area right there. It'll be a little indentation. Very important part or place for you guys to know. That right there is where your cartilage is. So when you're palpating, you're actually palpating the outer edge of the cartilage. Okay? The other one is they cross their leg over, bend their leg up, cross their leg over. Sometimes if you, then you can feel it on some people more than others. You can feel it on you. Huh? Little pain? Little pain. But you can, sometimes if you palpate right across there, you'll feel the lateral collateral ligament. It'll feel like a tight little band. I can't feel it on you. Some people you can feel it, some people you can't. Okay? The other thing part of the knee is you want to be able to feel the head of the fibula up here. That is where, one, the lateral collateral comes down and attaches. Your hamstrings come down and attach. Your biceps femoris from your hamstring. Also, your IT band comes down. Okay, and attaches there. So, very important structure is that head and where it is. So those are the structures, places I want you guys to find today, as well as we're going to go over the video. So you're going to feel the malleolus, the dome of the talus, the metatarsal heads, the patella, tibial tubercle, joint line. Okay, you need to find the joint line, and the lateral collateral ligament. Okay, and again, the joint line is very important because when you go through the valgus and varus stress test, the palm of your hand has to be right at that joint line. If it's above the joint line or below, you can't get an accurate test. You have to be right at the joint line so you can get the flexion against it. Okay? Any questions on what you're going to be palpating? Okay. And again, get it in with your fingers. Okay. Would it be better for you guys, do you want to go through the palpation now and then watch the video, or you want to watch the video now and then go through everything again?
Let's go through the palpation.
How many would like to do palpation first? How many want to do video first? Outnumbered. Sorry.